So if you think about the industrial process of vulcanizing rubber, there is this very strict rule of thermodynamics that you just cannot cheat. You take raw, sticky rubber, add sulfur, and apply heat and pressure. Do it exactly right, and you get an incredibly strong material.
Right.
But if you try to speed it up by, you know, blasting it with double the heat, you don't get the tire faster. You just melt the rubber into a useless puddle of slime.
Which is, I mean, that's a perfect illustration of thermal thresholds. You can
Yeah.
really only push a chemical or biological structure so fast before you stop upgrading it and just start destroying it.
Exactly. And we accept this in chemistry, right? We accept it in cooking. But when you step into the world of medical aesthetics, we suddenly expect the human body to behave, well, entirely differently. We want maximum results, and we basically want a total restructuring of our collagen on our lunch break.
Yeah, it creates this fascinating tension between what consumers demand and what human biology can actually tolerate without tipping over into irreversible thermal damage.
So that brings us to our central mission for you today as we dive into this. With so many clinics aggressively marketing these treatments, do the newer radio frequency, or RF, devices actually shorten your treatment time and require fewer sessions?
That's a really important question.
Right. Or are we just being sold a faster, hotter wand that ignores our biological speed limit? And to answer this, we are tearing into a huge stack of clinical journals, medical aesthetics, clinic data, trial registries, and even the latest urological guidelines.
We're covering a lot of ground today.
We really are. We are looking at RF's use in everything from cellulite reduction to intimate vulvovaginal health. But before we get into the newer 15-minute procedures, let's establish the ground floor here.
Sure.
If we are trying to tighten skin, what is the actual biophysics of RF? Because this isn't a laser,
No, not at all. It is a completely different mechanism.
Yeah.
A laser uses, directed light to target specific things like pigment or water, often literally burning the surface
Yeah.
to force a healing response. But radio frequency energy, on the other hand, induces oscillating electrical currents deep within the subcutaneous tissue.
Meaning the wand is essentially creating a localized electrical field inside your body.
Precisely. And within that electrical field, you have water molecules. Water molecules have a permanent dipole moment. They have a slight positive charge on one end and a negative charge on the other.
Okay, so they react to the field.
Exactly. When you apply this high-frequency alternating current, those water molecules are forced to rapidly flip back and forth, aligning themselves with that shifting field millions of times a second.
But the tissue is thick, right? It's viscous, so those water molecules can't just spin freely.
Right, they cannot.
Yeah.
There's immense physical resistance to that movement. That mechanical attrition, what we call Brownian kinetic energy, dissipates entirely as heat.
Oh, wow. So it's from the inside out.
Yeah. Unlike an oven, which heats from the outside in, RF utilizes the electrical resistance of your own tissue to generate heat from the inside out. And the absolute magic temperature range for this is 40 to 45 degrees Celsius.
I feel like there's a biological reason we cap it at 45 degrees.
There is. Sustaining tissue at 40 to 45 degrees Celsius provides the ideal thermal relaxation time. And that is what's required to trigger the body's natural wound healing cascade.
Like getting the body to rebuild itself.
Yes. Specifically, it activates fibroblasts to begin the creation of new collagen and new elastin fibers. And crucially, staying in that very specific temperature window accomplishes this without triggering your pain receptors.
Okay, but here's the timeline problem for you. If it's just about generating that internal 45-degree heat to force the tissue to rebuild itself, why did older RF modalities require you to sit in a clinic for up to 20 separate sessions?
Well, that goes back to your rubber analogy.
Right. Why couldn't the practitioner just turn up the current, generate more heat, and get the structural matrix to tighten up in one visit?
Because of what happens to proteins at higher temperatures.
Yeah.
If you bypass that 45-degree sweet spot and heat the tissue to, say, 60 or 67 degrees Celsius, you are no longer just stimulating the collagen to rebuild.
You are destroying it.
Completely. You are irreversibly denaturing it. The hydrogen bonds holding the collagen together physically break apart.
Yikes.
The protein literally melts. At that point, you cause severe pain, thermal burns, and you create the need for significant surgical recovery time.
So the body truly has a hard biological speed limit. You simply cannot crank the dial to 60 degrees.
You cannot. The goal of newer technology isn't to just turn up the heat and burn the patient to save time. The engineering challenge is figuring out how to shorten the sessions while strictly staying inside that safe 40 to 45 degree threshold.
Which means if they can't force the reaction with more heat, they have to find a back door to make the tissue more vulnerable to the lower heat.
Exactly.
And looking at the clinical journals we polled, the answer seems to be synergy. There is this fascinating study in our stack from the Journal of Clinical and Aesthetic Dermatology about cellulite on the hips and thighs.
And cellulite is a brilliant test case for this because it is notoriously difficult to treat. It isn't just about localized fat. It's a complex structural issue where enlarged fat pockets push upward through rigid vertical bands of connective tissue.
Creating that dimple topography on the surface, right?
Exactly.
And the historical data in this study really highlights the time burden we were just discussing. Older treatments required anywhere from 6 to 20 separate RF sessions just to achieve a mild reduction.
It was a huge commitment.
Or patients were subjected to 6 to 12 sessions of acoustic wave therapy, which just aggressively pummeled the tissue. But this study examines a newer device called M-tone, which combines monopolar RF with targeted pressure energy, or TPE.
This is a textbook example of overcoming that biological speed limit through combined modalities. TPE is mechanical energy, like rapid acoustic pressure waves.
Okay.
When you deliver that mechanical shock wave into the tissue at the exact same time as the thermal RF energy, you create an environment that fundamentally alters the thermal properties of the connective tissue.
Wait, how does acoustic pressure change the thermal properties? That sounds wild.
Think about those rigid collagen fibrils that make up the connective bands. When the mechanical stress of the TPE hits them, it causes those fibrils to physically dissociate. The pressure essentially shakes their structural integrity loose.
Oh, I see.
And when they dissociate, their inherent thermal stability plummets.
So you are artificially lowering the threshold required to get a chemical reaction. By shaking it loose, the tissue becomes hyperreceptive to the heat.
Exactly. Because the thermal stability is heavily reduced by the mechanical pressure, the RF energy does not need to be as hot or applied as long to achieve the necessary collagen denaturation and the shrinkage of the fat cells.
Wow.
The TPE does the heavy lifting structurally, allowing the RF to do the heavy lifting thermally.
Which directly answers our mission for the listener today. Because they combine the mechanical and the thermal, the time savings are massive. According to the study, treatment times drop to just 10 to 25 minutes per session.
Yes, a huge reduction.
And instead of 20 sessions, patients only need 4 sessions spread over 2 to 4 weeks.
And we aren't seeing a drop in efficacy either. The study notes that 86% of patients reported high satisfaction, and those circumference reductions were maintained at the 6-month follow-up.
Now, if combining modalities lets us lower the thermal threshold without losing efficacy, that opens a massive door. Because it means we can start treating much more delicate tissue where you absolutely cannot afford excess heat.
Right, which explains the enormous leap we are seeing in the sources regarding women's intimate health. Specifically, treatments for genitourinary syndrome of menopause, or GSM, and vulvovaginal atrophy.
Right.
These are conditions characterized by a drastic drop in estrogen, which thins the vaginal mucosa and leads to severe dryness, pain, and mild stress urinary incontinence.
And for decades, the options were largely limited to daily topical hormones, which carry their own systemic risks, or highly invasive surgical procedures. But the newer RF tech has been specifically modified for this environment.
Yes, utilizing a technology called DQRF, dynamic quadrupolar radio frequency, like you see in the EVA device.
Before we get to the time savings, how does quadrupolar solve the heat problem compared to older methods?
To appreciate the leap, you have to look at traditional monopolar RF. Monopolar systems use a single active wand, and the electrical current has to travel all the way through the patient's entire body to exit through a large grounding pad, usually on the thigh or back.
So the electrical field is literally passing through your internal organs to complete the circuit.
It is a systemic path of electricity. And because you have to push that current through the heavy resistance of the whole human body, you have to use a significant amount of energy, which means a higher risk of collateral thermal burns.
And a thermal burn on the vulva or vaginal tissue is the ultimate nightmare scenario.
It is entirely unacceptable. This is why DQRF is such a breakthrough. It completely eliminates the need for the grounding pad. It uses 4 distinct microelectrodes positioned right next to each other on a single small probe.
So instead of blasting current through the whole body, the energy is just playing a microscopic game of catch at the tip of the wand.
That is exactly what is happening. An algorithm continuously cycles those 4 electrodes between acting as receivers and transmitters, generating a tightly contained, repelling electric field right at the surface,
And I assume the power requirement drops significantly because it doesn't have to travel through the body.
exponentially. These devices only need to use 11 to 15 watts of power. It is an incredibly low-energy, precise system that nearly eliminates the burn risk.
But wait, if they're only using 11 to 15 watts, how are they getting the fast results? Our sources show these intimate treatments taking barely any time at all. There has to be another synergy here, replacing the mechanical pressure we saw with cellulite.
There is. The time-saving element comes from pairing the DQRF with a technology called UPR, or ultrapulse radiooperation. It's essentially an advanced adaptation of electroporation, which genetic engineers use to force macromolecules into living cells.
Okay, that sounds like molecular lockpicking. How are they adapting that to tissue rejuvenation?
The UPR technology modulates the radiofrequency waves to physically alter the cell membranes in the tissue. It temporarily forces open microscopic aqueous channels.
Wait, it's literally blasting temporary holes in the cell membrane.
Exactly. And while those channels are held open by the RF energy, the practitioner applies a topical active ingredient, usually a low molecular weight hyaluronic acid.
Oh, wow.
The UPR allows that highly hydrating compound to bypass the epidermal barrier and flood deep into the subepithelial tissue.
That is incredible. I mean, if you just rubbed a hyaluronic acid serum on the surface, the molecules are far too large to penetrate. They just sit there.
Exactly.
The UPR picks the lock, opens a cellular door, shoves the hydration directly into the matrix, and lets the door close behind it.
It delivers biological building blocks exactly where they are needed, utilizing the physical channels created by the low-level energy.
And looking at the protocols in the clinical registries, the efficiency is just staggering. Patients are only undergoing 4 sessions. For external vulvar rejuvenation, it is a 10-minute session.
Yes.
For deeper internal vaginal treatments, it's roughly 25 minutes spaced a couple of weeks apart. Faster treatments, absolute zero downtime, and no anesthesia required.
It fundamentally shifts the patient experience.
Right.
You are taking a condition that used to require painful surgery and turning into a 20-minute painless protocol that a patient can undergo on a lunch break.
Now, if you start researching this landscape on your own, you aren't just going to see DQRF and M-tone, you are going to hit a wall of medical jargon.
Oh, definitely.
Bipolar, multipolar, fractional, and brand names like Votiva, Forma V, Thermiva, Morpheus 8V, or V-tone. Let's synthesize what is happening across the wider market. Are all these devices utilizing the same backdoor physics?
They employ slightly different delivery mechanisms tailored for specific symptoms.
Yeah.
Bipolar devices like Forma V or Thermivi use 2 electrodes to pass the current back and forth locally.
Right.
Fractional microneedling RF, like Morpheus 8V, takes a different route entirely by using tiny physical gold-plated needles to deliver the RF energy directly into the deeper dermal layers.
And V-tone seems to be the outlier here in the intimate health space.
V-tone is slightly different. Instead of focusing primarily on thermal neocollagenesis, it utilizes intravaginal electrical muscle stimulation, or EMS. It sends targeted impulses to force involuntary pelvic floor contractions.
And the literature notes that a single 30-minute V-tone session is the equivalent of 17,000 Kegel exercises. That is wild.
It really is.
But looking across the board, the one unifying factor seems to be the clock. Treatment times have all been reduced to roughly 10 to 30 minutes. If they are all using slightly different physical methods, what is the core innovation allowing every single one of them to speed up?
It actually isn't the heat generation itself. The true innovation that slashed treatment times across the entire industry is automated safety.
Oh, are you talking about temperature sensors?
Far beyond just sensing. Modern devices employ dynamic software protocols like automatic temperature control and radiofrequency safety systems. They monitor the precise tissue temperature in real time, hundreds of times a second.
So they cut off if it gets too hot.
Exactly. If the tissue approaches that critical 43 or 45 degree threshold, the machine automatically throttles or completely cuts off the energy in milliseconds.
But I'm going to push back here. Doesn't that just de-skill the profession? Shouldn't the practitioner's skill be the ultimate safety measure? Why are we letting a computer ride the brakes on an electrical current inside a patient's body?
Well, because human reaction time is fundamentally the bottleneck when it comes to speed. In the past, the practitioner had to constantly stop moving the wand, visually assess the tissue, ask the patient if it was getting too hot, and manually measure the surface temperature.
Oh, I see. They had to drive 10 miles an hour because they couldn't see around the corners.
Exactly. The human element of constantly pausing to ensure they weren't causing a third-degree burn took up 50% of the appointment time.
That makes total sense.
By integrating automated thermal shutoffs, they can deliver the energy much faster, and with complete confidence, knowing the software physically will not allow a burn to happen. The automation of safety is what truly shrunk the clock.
That is a crucial distinction. It's not that the tissue is heating faster, it's that we stopped wasting time checking the thermometer. But this brings us to a reality check for you listening.
Yeah.
Because these 15-minute lunchtime procedures sound miraculous, but biology always extracts a toll. If I get my collagen thermally tightened in 20 minutes, is that result permanent?
It is definitely not permanent.
Yes.
And that is a vital expectation for any patient to manage. You have to remember that the human body continues to age.
Right, your chronological clock does not stop.
Exactly. Hormonal changes, particularly the lack of estrogen post-menopause, will continue to degrade tissue elasticity and moisture over time.
So how long does the remodeled tissue actually last before you need more?
The clinical data on longevity shows that external aesthetic results might last around 6 months before noticeable laxity returns. Internal functional results, like improved lubrication or mild incontinence reduction, can persist up to 12 to 15 months.
So this is absolutely an ongoing management strategy. It's a subscription model for your tissue, basically. You have to go back for annual maintenance sessions.
Correct. It is not a permanent surgical fix.
Yeah.
And when we look at the broader scientific consensus, there's another very important layer of caution to acknowledge.
Right. If we look at the joint guidelines from the American Urological Association, the SUFU, and the AUGS.
Yes, they paint a very specific picture of where this technology stands medically. Despite explosive commercial success and high patient-reported satisfaction, there's a striking paucity of level I evidence.
And by level I, you mean large-scale, long-term, randomized controlled trials.
Exactly. The rigorous multi-year placebo-controlled data required for sweeping medical endorsements is largely missing. These devices are often cleared by regulatory bodies under general tissue heating pathways, rather than for specific long-term disease claims.
So they get to market fast, and the rigorous scientific trials end up trailing years behind the commercial hype.
Precisely. Clinicians are seeing it work beautifully in their offices, but the academic literature is still catching up.
Which doesn't mean the biology is fake or the treatments don't work, right? The AUA concedes the technology is highly promising and, compared to surgery, extremely low risk.
Yes, the adverse events in the registries are almost entirely limited to temporary redness, mild spotting, or transient discomfort. But strictly scientifically speaking, we are still waiting for the massive data sets to prove long-term efficacy.
Which brings us back to our core focus for this deep dive. Yes, newer RF devices absolutely do shorten your treatment time. Gone are the days of agonizing multi-hour, 20-session regimens.
It is a remarkable engineering achievement.
It really is. By creatively finding back doors to lower the thermal threshold, like pairing RF with acoustic pressure waves, or using molecular lockpicking like radiooperation to drive hyaluronic acid into tissues, they've successfully optimized the body's natural healing response.
And automated safety software removed human hesitation.
Exactly. They get right up to the edge of that biological speed limit without crossing over into thermal damage, reducing visits to a handful of 15 to 30-minute sessions. Which leaves us with a final thought for you to mull over.
Oh, this is a good one.
As these non-invasive devices become faster, smarter, and ever more efficient at manipulating our cellular structures, will we eventually hit a hard biological wall on how fast the human body can actually regenerate, no matter how clever the tech gets?
Right.
Or will these quick, energy-based tune-ups continue to evolve until traditional scalpel and stitch cosmetic surgery becomes entirely obsolete? If you can restructure the building blocks of your own tissue from the inside out in 15 minutes, why would you ever go under the knife again?
It's a great question to ask.
Something to think about. Catch you on the next deep dive.